Okay, so the first thing that we're going to do is work on some soft tissue mobilization. So the different areas we're going to focus on are the bicep, tricep, and then forearm. So first I'm going to go ahead and just make sure the elbow is nice and comfortable, and I'm going to tell the patient it can just relax right here on my arm or on my shoulder. I'm just going to roll this up. And first I'm going to start off with something very simple and just do a little bit of effleurage. Can go in line with the muscle belly. Relax your arm right there. Can go in line with the muscle belly. And you can even do circles like this. And then another technique you can do is just kind of lining the muscle bellies itself. So I can just take my thumb and go right in between, try and separate those muscles in case they're kind of like clumped and stuck together, break up any bondages there. You can go up, you can go down. Another one I like to do is find where the biceps muscle is. So go ahead and contract, or go ahead and bring your arm up to your face. Yeah, right there. Okay, relax. So right under here, you can feel that, is where the brachialis will be. So you can kind of line that as well. I feel a little lump here. Another thing you can do, so all of these techniques have been running parallel with the muscle. Another thing you'd want to do, I don't want to get right in front of the camera, but you can go ahead, you can relax this on your stomach, but you can do long axis distraction perpendicular to the muscle. You could also do some, I don't know the actual technique, Dr. Erickson taught us J-stroking to that muscle. And then you could also take the muscle belly itself and do some bending. And then you could do some kneading. So I showed all the techniques here on the bicep, but I'll move in and just show a couple of them on other areas. So the next one for triceps, you can expose the triceps like this. I'm just gonna hold here. And same thing. If you, I'm not gonna reposition my patient, but if you wanted to, the arm could just hang over the side of the bed. That way, just relax. You could put a bolster under here. You could also, go ahead and relax your arm for me. Just leave it right here. But these are all positions in which the patient is supine. Easier access would be if the patient was prone. But same thing, you can go in line with the muscle here. You can go perpendicular. Like that. Do some long axis distraction. You can go this way. And that's for the triceps. So then the next one, you want to focus on the forearm. So these here, you're going to do flexors and extensors. So flexors, a good one is just taking your thumbs and stretching out the muscle like that. You can also, I didn't mention it before, but you can do some skin rolling. Help kind of make it a little more elastic. And then for a lot of patients with lateral epicondylitis, a very good soft tissue mobilization here would be cross friction. So you can go ahead at the insertion, maybe even up a little higher, down low, depending on where you are. And you just want to cross friction that. So cross friction is normally like 5 to 8 minutes. And you want to make sure that your finger's not moving, you're staying in that same spot, moving back and forth. All the other techniques that I showed, you could do for, it depends on the severity, how tight they are, but usually I'd spend about 15 minutes on soft tissue mobilization in general. One other thing that you could do, if the tendon seems like very stuck or grouped together and you want to separate those group of tendons, you can take one individual tendon and just kind of glide it. Work your way down. All right, so I think that is it for those. Next would be, one more thing that I didn't want to forget as well. Say you're doing bicep just because she's in the best position to do this muscle. As you're applying massage, you can move the muscle in different positions. Another thing that way you're putting it on tension and on slack. Another thing that you could do is you could do mobilization with movement, but do active range of motion. So I could say, all right, put your arm here, and I want you to go ahead and bring your bicep up. Bring your hand up to your face, good, and back down. So this technique works really well for trigger points. And you can do that with any of the actions. So go ahead, I found a little trigger point here, so I'm just gonna apply some pressure. Go ahead and bring it up and back down. Good. So that's it for today. So for the next one, we're going to treat neural tension. And there's two different ways you can do this. You can perform, you can just put the nerve under tension, or you can do a glide in which you're kind of flossing the nerve, moving that connective tissue. So the first one, I'm going to go ahead and put the elbow or shoulder at 90. I'm going to externally rotate the shoulder. Now I'm going to extend the wrists and fingers, and then I'm going to extend the elbow. So I'm going to stop once I feel a little tension, which is right about there. And then I'm going to hold it for 6 seconds and then relax. And I can do that up to 10 times. The next one that we're going to do is called nerve gliding, and same thing. So we're working the median nerve here. I'm going to put the arm at 90, externally rotate. I'm going to grab onto the hand, fingers, and I'm just going to slowly extend the elbow. Once I feel that tension build up, I'm going to start the gliding. So I'm going to tell the patient, move your head to the left while I move your elbow in. So 1, 2, 3. So move your head to the left. Good. And then back this way. And then to the left. And then back this way. Good. So this is just gliding that nerve back and forth, and the rule of thumb for that is that you want to be 2 joints away. So you have the head, the shoulder, and then you have the elbow. And that is treating the median nerve. Okay, so the next part I'm moving into involves elbow mobility, so joint mobility. The first thing I'm going to start off with, these are all the same assessment skills that we did earlier, but I'm going to start off with distraction. So distraction's a good one to kind of get the patient comfortable and just increase range of motion in general within that joint before performing a specific action. So if I wanted to focus on humeral ulnar distraction, I would pin down the humerus to make sure it's not moving, put my hand as close to the joint as possible, and go ahead and apply that distraction. So right now I'm not going to focus on grades 1 and 2 mobilization since that addresses pain, but for all of these I'm just going to do a quick 3 through 4 as we're trying to increase mobility. So this would be a grade 3 and then grade 4. Next, I'm going to do radial humeral distraction. So for this one, I like to be inside the patient's arm here. And I'm going to, nope, you can keep your arm right there. I'm going to pin down the humerus. That way it doesn't move. And I'm going to take a little grip like this and just pull like this. So this is going to be a grade 3. And then grade 4. Next, after distraction, I'm going to increase flexion. So increasing flexion within the humeral ulnar joint, I'm going to, same thing, stabilize the humerus, and I'm going to come here so my arm's perpendicular and go ahead and apply grade 3 mobilization and grade 4. And I can go through different ranges of this as well, as long as my arm's staying perpendicular. So that one's on the ulna. The next one, you want to make sure that you're on the radius for flexion. So same thing, you're going to grab the radius here, and you can apply the same pressure. So you just want to go in a, oh, I'm still on the ulna. There we go. I can come down here where the radius head is and apply that force. So if you wanted to create a fulcrum, you do the same thing. Put this here, find the radius, and apply that pressure. And grade 4. So extension is going to be the exact same thing. You can come from this side. There we go. You can come from this side and you can push onto the radius to increase extension. Or if extension was limited and it was here, you could push this way. But I would have this pinned down and I would grip the radius and push. Same thing, but you can grab the ulna, pin down, and apply that.